The price of giving birth in the United States has just become hundreds, even thousands of dollars more expensive. And it has absolutely nothing to do with new miracle technology, advanced medical procedures, or a higher standard of care. The real reason is a silent, almost invisible takeover happening right under our noses. A massive transformation of the American healthcare industry that is proceeding with virtually no government oversight.
This isn't a distant academic problem. It's a fundamental restructuring of who owns your doctor's office, and it is directly responsible for inflating your medical bills. Today, we are pulling back the curtain on a trend that is radically reshaping the $1 trillion physician industry, costing you and your insurer a fortune every single year.
We are going to explore a groundbreaking study led by top economists from Yale University that used cutting-edge technology to uncover a secret that was hiding in plain sight. In this investigation, we'll reveal just how widespread this hospital takeover of private practices has become, how sophisticated machine learning algorithms were needed to even see the pattern, and most importantly, what this consolidation of power means for your wallet every single time you step into a clinic or hospital. And we'll ask the critical question: why are the federal regulators, the very people meant to prevent these kinds of anti-competitive mergers, almost completely powerless to stop it? The answers are shocking, and they affect the health and financial well-being of every single American. Think about it for a moment. The relationship with your doctor is one of the most personal and trusted you have. You rely on them for unbiased advice, for referrals to the best specialists, for guidance through life's most vulnerable moments. But what happens when your doctor is no longer an independent practitioner, but an employee whose incentives are aligned with a massive hospital corporation? Does their advice change? Do your options for care shrink? And does your bill mysteriously grow? This isn't speculation. This is the new reality for tens of millions of Americans, and it's a reality that has been constructed piece by piece, without public debate or regulatory oversight. A quiet revolution has been underway in the American medical landscape. While we've been focused on insurance debates and prescription drug costs, the very structure of how medical care is delivered has been fundamentally altered. A new study, published as a working paper by the National Bureau of Economic Research, has put a number on this seismic shift. Using an unprecedented combination of data and advanced analytical techniques, a team of researchers from Yale, Harvard, the University of Wisconsin-Madison, and other prestigious institutions found that between the years 2008 and 2016, hospital ownership of private physician practices spiked by an incredible 71.5%. Let's put that in perspective. In less than a decade, the share of physicians working directly for hospitals nearly doubled. By the end of that period, in 2016, hospitals owned a staggering 47.2% of all private medical practices. Nearly 1 out of every 2 doctors' offices was no longer an independent small business, but an arm of a large hospital corporation. This wasn't a gradual evolution. It was an aggressive, fast-paced acquisition spree that occurred across all specialties, fundamentally changing the competitive dynamics of local healthcare markets all over the country. This profound change, affecting an industry that accounts for roughly 6% of the entire U.S. gross domestic product, happened largely in the shadows. So how did the researchers manage to track a phenomenon that was so widespread, yet so difficult to see? The answer lies in the power of modern technology. Yale economist Zach Cooper, one of the study's co-authors, explained the immense challenge. He said, "It's a project that simply would not have been possible if we didn't have machine learning and had to use humans to analyze each physician record. The team had to combine a rich tapestry of different data sets, everything from Medicare billing records and hospital surveys to physician directories and even filings with the U.S. Securities and Exchange Commission. The complexity of this task cannot be overstated." The American healthcare system is a labyrinth of private practices, hospital networks, and complex corporate structures. Ownership isn't always publicly declared in a simple database. A practice might be owned by a holding company, which in turn is owned by a larger hospital system. The researchers had to become digital detectives,
training their AI to sift through mountains of text from obscure financial documents and cross-reference it with billing data and physician directories just to answer a simple question: who owns this doctor's office? This Herculean effort is a testament to how opaque our healthcare system has become and why such a fundamental shift could go unnoticed by the public for so long. This technological breakthrough allowed them, for the first time, to see the full scale of the consolidation and, more importantly, to measure its direct impact on prices. So, how does this invisible takeover actually hit your wallet? To find out, the researchers decided to focus on one of the most common and most expensive reasons for a hospital stay among privately insured individuals: childbirth. What they uncovered is nothing short of breathtaking. Imagine a local, trusted OB/GYN practice, one that has served its community for decades, gets quietly bought out by the major hospital down the street. For the first year or two, on the surface, nothing seems to change. The same doctors, the same nurses, the same receptionists. But behind the scenes, in the billing department, a new financial strategy is being implemented. The study found that just 2 years after a hospital acquires an OB/GYN practice, the hospital's price for that very same labor and delivery process jumped by an average of $475. That's a 3.3% hike for the hospital's facility fee. But hold on, because that's not even the most shocking part. The price that the physician charges, the doctor who is now a hospital employee, for their services during that same childbirth, that price skyrocketed. It shot up by an average of $502. That isn't a 3% increase. That's a jaw-dropping 15.1% increase. Let that sink in for a moment. 15%. For the exact same service, from the exact same doctor, in the exact same delivery room. The only thing that changed was the name on the doctor's paycheck. The study was meticulous in searching for any justification for this price gouging, but they found none. There was no discernible effect on the quality of care. So where did that extra $1,000 or so go? Straight into the coffers of the newly consolidated healthcare giant. This isn't just an abstract economic finding. This is a real cost passed on to new parents, often at one of the most financially and emotionally stressful times of their lives. It's a hidden tax levied not by the government, but by a corporate entity that has successfully cornered the local market. The insurance company might pay a large portion of it, but that cost is inevitably passed back to everyone through higher premiums, deductibles, and copays. In essence, we are all paying for this lack of competition, whether we are having a child or not. If you find this revelation as shocking as we do, please hit that like button to help this information reach a wider audience. It's a story that affects everyone's bottom line. The core reason for these price hikes, the study concludes, is simple and classic economics: a reduction in competition. When a hospital buys a physician practice, it's not just acquiring an asset, it's eliminating a source of competition and gaining control over a stream of patient referrals. This is what's known as a vertical merger, a merger between companies at different stages of the supply chain. While previous research has shown that horizontal mergers, like one hospital buying another, lead to price increases, the effect of these vertical mergers was less understood until now. Let's break down what this really means. When a hospital buys a primary care practice, they're not just buying a building and some staff. They are buying a gateway to patients. Your primary care doctor is the gatekeeper of your health journey. They are the one who refers you to a specialist when you need a cardiologist, an oncologist, or an orthopedic surgeon. If that primary care doctor is now a hospital employee, where do you think you're going to be referred? To the specialists who also work for that same hospital system. This creates a closed loop, a walled garden of healthcare where the hospital captures your business at every single stage. It chokes off referrals to independent specialists who may be cheaper or better, further weakening competition and driving them to either sell out to the hospital themselves or go out of business. It's a vicious cycle that centralizes market power and leaves patients with fewer choices and higher bills. This brings us to the most alarming part of this entire story, the regulatory black hole. You might assume that a massive, industry-wide wave of mergers would attract intense scrutiny from federal antitrust regulators like the Federal Trade Commission. You would be wrong.
The researchers estimate that an unbelievable 99.9% of the thousands of acquisitions they analyzed fell below the federal reporting thresholds for business mergers. This means that this massive transformation of the $1 trillion physician industry occurred almost entirely off the government's radar. It was a stealth consolidation, happening one small practice at a time, transaction by transaction, all too small individually to trigger a federal review. Zach Cooper of Yale stated the problem bluntly. The sharp increase in hospital-physician mergers has reshaped the physician industry, significantly raising prices for patients and insurers without improving the quality of care. Unfortunately, there is no reason to believe that the pace of acquisitions has or will slow down. He continued, "There are hundreds of thousands of small physician practices, and federal regulators are not in a position to keep up with the rapid pace of transactions. The system designed to protect consumers from anti-competitive behavior is simply not equipped to handle this type of widespread, piecemeal consolidation. And this isn't a problem confined to obstetrics. The study's data shows the acquisition trend is happening across all medical specialties, though at different rates." Over the period studied, hospital acquisitions of cardiologists increased by an enormous 38.4 percentage points. For primary care doctors, the increase was 18.1 percentage points. And for the OB/GYN practices at the center of their price analysis, acquisitions grew by 20.4 percentage points, reaching a point where nearly half were hospital-owned by 2016. The evidence that these price hikes are driven by market power, not value, is overwhelming. In one of the most damning findings, the researchers discovered that prices for physicians who were already employed by a hospital still increased significantly after their hospital acquired another competing physician practice in the same specialty. These already integrated doctors saw their prices jump by an average of 9%. Think about that. Their practice hadn't changed. Their skills hadn't suddenly improved. Nothing about the service they provided was different. The only thing that changed was that their hospital employer now faced less competition in the local market. Fiona Scott Morton, a co-author and professor of economics at the Yale School of Management, put it perfectly. It's unlikely that these practices had a sudden change in quality or bargaining ability just before their hospitals merged with a new practice. The study provided even more proof, finding that hospital price increases were largest in cases where the newly acquired doctors had previously practiced at a rival hospital. By buying them out, the acquiring hospital could control their patient referrals, steering them away from competitors and cementing their market dominance. This directly indicates, as Professor Scott Morton says, that price increases result from reduced competition, not improved quality of care. So, is there any hope? Are we doomed to a future of ever-consolidating healthcare monopolies and the ever-increasing prices that come with them? The study does offer a glimmer of a solution. The authors suggest that policymakers can use their findings to better identify which types of hospital-physician mergers are most likely to lead to the largest price increases, perhaps allowing for more targeted regulatory action. Cooper also suggests that individual states could play a much more important role. Instead of relying on an overwhelmed federal system, states could pass laws requiring hospitals and physicians to proactively provide evidence on the tangible benefits of their proposed transaction before a merger is approved. The burden of proof would shift from the government having to prove harm to the merging parties having to prove a benefit to the public. In conclusion, this landmark study has exposed a fundamental and costly problem at the heart of the U.S. healthcare system. A massive, stealthy wave of acquisitions has allowed hospitals to take over private physician practices on an unprecedented scale. This consolidation, happening below the radar of federal regulators, has given these new healthcare giants immense market power, which they have used to significantly drive up prices for medical care, with no corresponding improvement in quality for patients. The story is a powerful testament to how changes in market structure can have a direct and painful impact on the finances of ordinary families. This is just one piece of the incredibly complex puzzle of American healthcare. If you want to continue to understand the hidden forces that are shaping your medical bills and influencing your care, make sure you're subscribed and have notifications turned on, because we are just getting started. The next time you see a surprisingly high medical bill, you might just find yourself wondering if your trusted local doctor's office has a new, invisible corporate owner pulling the strings. It is a question that more and more of us will need to ask. The health of our families and our wallets depends